Welcome to the debridement simulator. I'm going to be doing a debridement on our full thickness debridement simulator model. This is a model of a full thickness pressure wound with eschar. There's hyper realistic skin around. Underneath you'll have some subcutaneous tissue followed by some necrotic and some regular appearing muscle tissue, and then finally underneath that the bony layer. We'll start by going over some common tools that you may use in a debridement setting. This is by far not an exhaustive list of tools that you can use, but these are at least the ones that we are most commonly going to be affiliated with, especially in a wound care setting. Some sort of sharp, sterile scissors like some iris scissors, some sort of pickups, forceps, whatever type of scalpel that you're comfortable with, 10, 11, 15 blade, something of that nature. And then some sort of curette, which is very beneficial in a debridement setting as well. We'll start by talking about some preparation. You can generally think of your setup as a clean environment. Would it be wrong to set up a sterile environment? Absolutely not. Your instruments obviously are sterile, and you want to maintain as clean of an environment as you possibly can. Again, this is just personal preference, and you would want to consult with your supervision on their recommendations. But generally, we again try to keep a clean environment, and if we can get a sterile environment surrounding the wound, great. Generally, I will use betadine swabs or iodine solution or some sort of skin cleansing solution around the peri wound, circumferentially going outward a few centimeters, and I usually will do that 3 times, each with a different swab or piece of soaked gauze. And then you can always put some sort of fenestrated towel down if you've got one big enough, but it just depends on who you ask whether you really need to do that. But it's always possible. I sometimes will use a fenestrated towel down below, downwind, if you will, where the blood will most likely be falling to kind of help catch any debris and blood. Well, we'll start by taking this eschar, and this eschar again is hyper realistic, very hard, and feels almost like the real thing, and it gives you a really nice simulation. Again, there's no written rule on how to do this, but generally I will use some pickups just to kind of test an area, just to see if there's a place that's a little bit looser, and it seems like this end here is a little bit looser. And going back just a minute, what about anesthesia? We'll be making more videos later on different anesthesia techniques, but I've seen people make this mistake, assume that this is a syringe with a needle. A lot of people I've seen will go directly into the non-viable tissue, the eschar, and deeper into the non-viable tissue, and you're really numbing that for no good reason. Generally, you want to numb circumferentially around. You want to numb the healthy tissue, and I generally will go through the necrotic tissue, through the non-viable tissue, and kind of aim for the healthy tissue this way, and try to leak a little bit of the lidocaine or xylocaine or whatever solution you're using, and then just kind of either clockwise or counterclockwise go around, and again circumferentially just shoot that anesthetic from the necrotic tissue into the healthier tissue with intact nerves. We'll go back to the removal of the eschar. Again, I found the edge that's kind of loose, if you will. We've achieved good anesthesia, so we'll kind of use our scissors to start here, kind of get us a little lip going, and we can switch to something like a scalpel. That often works well. Again, taking your time and looking and checking for bleeders and dealing with those as you go. And you can kind of assess the quality of the material underneath as you get more of the eschar removed. We'll finish off by using a little iris scissor here. And there we have the eschar removed, and we're looking at some necrotic subcutaneous tissue here. Continuing with the debridement of the non-viable subcutaneous tissue, again, there's no tool that you have to use, but you use a combination of tools, whatever is more convenient for you. You could start out using something like a scalpel to kind of get a little lip or a ledge started to kind of release the tissue. We'll show you a couple different examples of things you can do. Again, trying to get a little lip here. Again, always being vigilant for any bleeders, and trying to achieve hemostasis. Switch to a curette. The curettes that I have used in the past always have a little, almost like a sandpaper area here that's designed for the index finger to give you some grip, and that usually will show that the opposite side of that is generally sharper than the top. And just with the curette, you've got a little bit of a finer digging motion, if you will, to extract that non-viable tissue. I often use it in the subcutaneous portion of a debridement, and then the harder tissues like bone, cartilage, fascia. In this instant, I've got a big chunk here that we can kind of use the pickups and use the scissors to kind of cut that out. And again, there's no mandatory set of tools you have to use. You find what works best for you, and oftentimes it's a combination of several different instruments. Often you can get a big kind of field of necrotic tissue like that with some scissors, and you can go around and use something like a curette to kind of make your finer detail cuts, if you will. Again, being vigilant about bleeders. We hope to, in the future, have a more advanced model which will have some simulated blood and blood vessels, which you'll be able to practice doing your ligation suture, such as a figure 8. If you run into a pumper that's actively bleeding or hemorrhaging. At this time, this model's more just for basic, just to get the look and feel and some confidence going into a big debridement like this. These debridements can be very challenging, especially your first go around. You're kind of timid and not confident, but this kind of allows you to gain some confidence. It does, honestly, it really gives you a really close look and feel, just like human tissue. Almost done here with the debridement of the subcutaneous non-viable tissue. Kind of clean some of these up here so you can get a better view of the next layer, which is the fascia / muscle layer. And we've represented the healthy muscle with red, as you can see here, and the necrotic we've made a darker gray black color. So generally we want to keep the healthy muscle fibers as best you can, but again, there will be some trauma to the healthy tissue, but you just want to limit the trauma to the good tissue as best you can. And this, again, is a great way to practice and kind of master your skills. All right, kind of use the curette to come back and make a little concave shape to our wound here. Get the remaining non-viable subcutaneous tissue out of the way. And just to speed this up, I would never use my hands to do this, generally speaking, but just for speed, we'll get the remaining subcutaneous tissue out with our fingers here. All right, so we'll finish up with the debridement of the muscle layer. I personally would use a combination of the scissors and forceps and scalpel, as those muscle fibers tend to be tough, and the curette may or may not work in that situation. Just you have to get used to it and kind of a trial and error as you go. Again, I usually will start with a scalpel and pickups and kind of make a little lip, just something to grab onto. And I am more comfortable generally with the scissors after that, and I will use that to go in and get the rest of the necrotic muscle fibers there. Again, the black or the gray, dark gray black tissue is representing the necrotic muscle fibers and fascia. And the red is representing healthy, so you want to try to preserve the healthy tissue. As best you can. Some fascia here we're going to clean up, and notice I'm not wearing gloves. It should be a given that you're going to do any kind of medical procedure with the appropriate PPE that is required for your facility and specific patient. underneath you'll see, I'll kind of spread these muscle fibers open here. You see some white, that's representing the healthy bone, and then we've got some dark, which is representing some necrotic bone. And in this case, we might have to sacrifice a little bit of the muscle tissue just so we can make a better surgical window into seeing what we're dealing with. And I'll do a little bit extra than I normally would for the camera as well. If you had an assistant helping you, you could have them providing some traction and retraction there to aid in preserving that tissue better and giving you a better view into your workspace there. All right, we'll finish up with doing a debridement of the necrotic bone. Again, the black represents the necrotic bone, and you can see white, which is the healthy bone. I generally will use a curette in this situation. For this demonstration, we'll use the curette, and you can see how that works pretty nicely there. And this has an eerily similar sound and feel as the real debridement, kind of like a chalkboard and fingernails. It kind of gives you raises the hair on your neck a little bit. Making good progress there. We'll kind of clean our curette out. Looking to get down to the viable surface. A lot of times during the procedure, you can send samples of your necrotic tissue off for sampling, and in this case we probably would go with a bone biopsy to screen for osteomyelitis. As you know or may not know, the best test for osteomyelitis is sampling of the bone itself. So when you're doing a debridement like this, you'll be in perfect position to grab a quick sample of bone to rule in or rule out underlying bony pathology. Made good progress there. Looks like we've got most of the necrotic bone debrided there. There's a few little stragglers here. There's different tools that you can use to get the bone sample. Rongeurs. You could even take, if you get a good deep scrape with your curette, you could use that. Sometimes I will use a scalpel to get a good little bite there, and put that in the appropriate container to send to the laboratory for confirmation of osteomyelitis. There we go. So, and that looks pretty good. I always will go around after I'm finished with the debridement and make sure, triple check that I've got all the necrotic areas. Check for any pumpers or bleeders and deal with those appropriately. We generally recommend any kind of hemorrhaging vessel, we recommend a figure 8 stitch. If you've got just kind of an oozer, you can try things like an alginate dressing with pressure, just a sterile gauze dressing with pressure. There are other things available that you can use, hemostatic dressings, but alginate is a good thing to have on hand, along with sterile gauze, and then obviously your sutures and a needle driver in case you need to put any kind of ligation in there. Thank you for watching.